There are 7 important movements that happen when we walk, and today I'm going to show you 7 exercises that you can do while you're in bed to help improve each of these movements. Doing these will help you walk faster and for longer distances. So this workout was made for people who've had a stroke and can still walk, but may need a walking stick or some assistance from someone else. The first time you do this, I do advise that you have someone there with you so they can keep you safe and also help out with some of the exercises. Before I show you each of these exercises, I'm going to show you a part of walking that it improves, followed by the exercise that helps to improve it. As a general rule, try to do each of these exercises for 10 to 20 repetitions. So let's get into the first important movement that happens when we walk. That first movement is this. So we lean forward and use the muscles in our hip to propel ourselves forward. Not being able to do this leads to us taking small steps when we walk. And if we're always taking small steps, that means we walk a little bit slower. So we want to work on improving the size of our step, and we can do that by doing this bed exercise. So you're going to lie down on the bed. Have your weaker side on the edge of the bed. So in this case, I drop my left leg down. That would be the weaker leg. You're going to push your heel into the ground. Your hips might lift off the bed slightly. Hold for 5, and then bring yourself back down. You can also put a cushion on the ground or a pillow on the ground so that you are pushing on something, and that might help you feel the muscles in the leg a lot more. If that version of the exercise is too hard, then you can just keep your leg up on the bed. You don't have to drop it down on the floor, and you can just keep your leg straight and push it down into the bed. So important movement number 2. After we've used our hips to push our body forward, we then continue that forward motion by using our foot and ankle to push us forward. Again, not being able to do this contributes to us taking small steps, and people end up shuffling without being able to use their feet when they walk. The next exercise will work on our foot and ankle so that we can do this movement better. So the next exercise is going to be in the same position as the first one. You're going to drop your weaker leg on the floor. Then you're going to push your toes into the ground, which is going to cause your heels to lift up. Try to hold for at least 5 seconds and then bring it back down. When you lower the leg down, try to keep it slow and controlled. Don't just let the heel drop to the ground. If this is too hard, then you can also just practice pointing your toes all the way down, away from your head, and then bringing your feet back up. Point your toes down away from your head, and point your toes back up. So important movement number 3. Once we've pushed off the ground, we then need to bend our knees so that we can clear the floor. Not being able to do this makes it hard for us to swing our legs in front of us, which then causes us to increase our risk of falling. The next exercise will help us with our knee bending, just like this. The next exercise is going to help us strengthen the back of the legs, and it's going to look like this. You're going to bend your knee. You're going to slide your heel up towards your bottom, and you're going to straighten it back down. So you're going to bend and straighten. If sliding the leg is too hard for you, you can get assistance from the other leg. So you're going to use the other leg to push the weaker leg up, and then you're going to just lower it back down. Use the other leg, push it back up, and then lower it back down. So the next move happens together with the knee bending. So as we bend our knee, we also want to pick our foot up. If we don't do this, we end up dragging our foot, and again, this increases our risk of falling. When people can't pick up their foot off the ground, that's called a foot drop. Some people get around this issue by compensating with their movement. Instead of walking and swinging their legs through the middle, they end up swinging the legs around the side. That way they don't have to pick their foot up as much. Some people also raise their knee up nice and high so that they don't have to lift their foot up as much. The next exercise will help you lift your foot up like this. So if someone can't do the next exercise at all, they might need a brace for their ankle, called an ankle foot orthosis. And this is normally prescribed by a physiotherapist. All right, so this exercise, you're just going to bring your toes up towards your nose, then lower it back down. Try your best to point your toe up towards your nose,
then back down. If this is too hard, you can use your other foot to help lift your foot and try to lower it back down by yourself. So you're going to use the good leg, the strong leg, to lift the other leg up and just try to lower it down by yourself. If the other foot's still too weak to slow down the descent, then you can keep your foot supported the whole time.
So important move number 5. We've lifted our leg, we lifted our foot. Now we have to swing our legs forward so we can actually take that forward step. That happens by using these muscles in front of our hips. We use it to bring our knee in front of our body. This is also important just in case we do lose our balance and we have to quickly bring our leg in front of us. So the next exercise will help you improve your ability to bring your leg in front of you, and you can practice this without needing to stand.
So we're still in the same position. This time you're going to bring your leg back up to the bed and then slowly lower it back down. Lift it back up onto the bed, then slowly lower it back down. If you want a harder version, you're going to put a pillow under your legs, and then you're going to lift the leg up onto the pillow and then slowly lower it back down. So this exercise, you're lowering your leg down to the ground and you're going to lift it up over the pillow. This is going to work the muscles in the front of your hip, which is going to help you take steps forward while you're walking.
So important move number 6 that happens when we walk. After we've swung our leg forward, we then need to straighten that lower part of the leg. When we straighten that lower part of the leg, it's now ready to take our weight and we can take the next step forward. So the next exercise just helps us strengthen the muscles that helps us to straighten the legs.
So here's another exercise in the same position. You're going to drop your leg down to the floor, then you're going to lift just the foot, straighten the leg as much as you can, and then slowly lower it down. So you're going to straighten the leg, hold for a few seconds, and lower it back down. This plays a big role in helping you stand and balance on one leg as you're walking. It helps you to transfer all your weight from one leg to the other.
All right, last movement. We've gone through pushing ourselves forward, swinging the legs over, and now we have to balance on one leg. If someone's not able to balance on one leg, even for a short time, this can give the appearance of walking with a bit of a limp. Also, if we can't balance on one leg, it doesn't give the other leg a chance to swing over and take a step forward. All of the previous exercises that I've shown actually works on this ability to stand on one leg already. But there is one muscle group that we haven't worked, and that's the muscle in the side of the hip over here. If the muscles on the side of our hip are weak, we sometimes compensate by walking with a bit more of a lean to the side. So people can end up walking with a big side to side movement like this. The next exercise works on our stability so that we don't waste our energy going side to side.
So for the next exercise, you're going to move yourself away from the edge of the bed. You're going to go in the middle and you're going to practice sliding your heel out to the side and bring it back in. So you're just going to practice moving your legs side to side, away from the body, towards the body.
If that version of the exercise is too hard, then you can grab a plastic bag, put your foot on it,
and you're going to use that to make it a bit easier to slide.
So when it comes to stroke recovery, everyone has different capabilities, and some of those exercises might have been too easy for some or too hard for others. If you're wanting a program that's a bit more specific and personalized to your abilities, feel free to reach out to our team at VUNO Physio. We can do home visits and mobile physio sessions if you're in Sydney. If you're anywhere else, we can do a telehealth call. And our contact details are in the description below. But if you're looking for another workout that can help improve your walking after a stroke, check out this video that I posted recently.